but I want to have like a mariachi event with cars or something like that. We're public and blah blah blah.
Okay.
Okay, after this presentation, then we have Catholic Charities, and then we'll have lunch. We ordered some box lunches so that everyone can have their own individual lunches. Everything is in the box, including your drink, so that shouldn't be too long from now. What's that? Yeah, sure. Again, one other thing that I want to really emphasize that I will need from everyone, we're going to be sending in a couple of days a survey monkey to evaluate today's presentation. These things can only happen when we get the inputs from the community so that we know what the issues are, so that we know how we can assist in working with the community to overcome issues that are impacting the community. So please do not ignore the survey. Send them back to us. We will very much appreciate everyone, as many people as can respond. It'll give us a baseline to know what else we can do and where again the most important and the most pressing issues are, so that work with the organizations in Imperial to overcome these issues. Then our next presenter is John Ohanian. He's the CEO of 211 San Diego and Imperial. Imperial just had a soft launch a few months ago, and you're going to hear more about what their strategies and plans for Imperial is from him. But most importantly, we had 3 organizations that were recipients of the outreach and education from Covered California. One of them was 211 San Diego. Imperial is only a part of it. I think Los Angeles, Riverside, and San Diego are the other 3 counties that they are recipients of Covered California funds for the outreach and education. We also had Catholic Charities who are also going to be presenting. Clínicas de Salud through the Council of Community Clinics, and Dr. Vega already did her presentation, are also the recipients of Covered California funds for the outreach and education here in Imperial County. So, Mr. Ohanian, as you will see for yourself right now, Mr. Ohanian, he is a great speaker. You're going to see that for yourself right now. He has been keeping up with what's relevant for Imperial County in regards to the Covered California. He's going to provide that presentation in a few minutes. A synopsis of his impressive background: he's a graduate of the Harvard Business School Executive Education Program. Under his leadership, 211 San Diego has gone from helping 100,000 clients to over 400 a year. He's created lasting relationships with communities, top public and private organizations, which by the way, one of them is San Diego Gas and Electric. And this is the perfect opportunity for me to thank San Diego Gas and Electric for so generously allowing us to use this facility for this meeting, really accommodating everything that we needed, and they just really went all out. So please, let's give San Diego Gas and Electric a warm applause. For supporting us on this. So with no further ado, let's welcome Mr. John Ohanian.
How's everyone doing? Okay, so raise your hand, because I came out a few months ago and did an orientation about 211. Raise your hand if you were here. Can you stand up for us? Can you stand up if you were here?
Stand up if you were here for the 211.
Okay, turn around. Look at everyone around. So these are your 211 ambassadors. We have such a great following already. I am the CEO. We use it as chief evangelist because that's my job, is to spread the word about 211. Out of the people that weren't here, raise your hand if you've heard of 211. And keep your hand up if you've used it. You used it? How long ago?
Not locally.
Oh, who's used it locally? We've had a few phone calls in the back. You've used it?
I accessed it yesterday to get some information. I haven't used it.
Who did you speak with?
Yet.
Oh, you haven't talked to them?
No.
You haven't talked to anyone? All right. So you might wonder what 211 has to do with hippos. You guys know what hippos are? So I'd like you to entertain me and just watch this quick little video. It's a couple minutes.
everything I do and everything I do professionally, my life has been shaped by 7 years of work as a young man in Africa. From 1971 to 1977, I look young, but I'm not. I worked in Zambia, Kenya, Ivory Coast, Algeria, Somalia, in projects of technical cooperation with African countries. I worked for an Italian NGO, and every single project that we set up in Africa failed. And I was distraught. I thought, age 21, that we Italians were good people and we were doing good work in Africa. Instead, everything we touched, we killed. Our first project, the one that has inspired my first book, Ripples from the Zambezi, was a project where we Italians decided to teach Zambian people how to grow.
Kevin, you messing with my internet.
Food. So we arrived there with Italian seeds in southern Zambia, in this absolutely magnificent valley, going down to the Zambezi River, and we taught the local people how to grow Italian tomatoes and zucchini. And of course the local people had absolutely no interest in doing that, so we paid them to come and work, and sometimes they would show up. And we were amazed that the local people in such fertile valley would not have any agriculture. But instead of asking them how come they were not growing anything, we simply said, thank God we're here. Just in the nick of time to save the Zambian people from starvation. And of course, everything in Africa grew beautifully, and we had these magnificent tomatoes. In Italy, a tomato would grow to this size, in Zambia to this size. And we could not believe. And we were telling the Zambians, look how easy agriculture is. When the tomatoes were nice and ripe and red, overnight, some 200 hippos came out from the river and they ate everything. And we said to the Zambians, my God, the hippos! And the Zambia said, yes, that's why we have no agriculture here. Why didn't you tell us? You never asked. I thought it was only us Italians blundering around Africa, but then I saw what the Americans were doing, what the English were doing, what the French were doing, and after seeing what they were doing, I became quite proud of our project in Zambia, because you see, at least we fed the hippos. You should see the rubbish.
So, has anyone seen that talk before, except for the people that came here before? You know, it was interesting. We were talking about what's been going on in San Diego, and over the last 6 years that we've been building an organization called 211 San Diego. And a few years, probably 5-6 years ago when I started, within the first 6 months after the fires hit, we started getting calls from Imperial County saying, you want me to speak even louder? Okay, I'll try. Okay, so we tried really hard coming out here and talking to a number of people about what would a 211 system look like in Imperial. And what we found out was, just because we had a successful program in San Diego and just because we had supportive partners, which took time, we needed to come out here and listen. And that's really what a part of a talk that I did here for 2 different groups. We had almost 100 people come through as we talked about 211 San Diego. And a part of today, obviously, we're going to talk to you about the healthcare reform and Covered California, which we have a role in. But the first part is to just understand what we do as an organization, what 211 is all about. And what you're going to hear is that 211 San Diego may look very different than 211 Imperial. And it's really up to all of you to decide what 211 should do here. What should our role be? Because we can be many things in different counties, but what's the greatest need here in Imperial? So we kind of use the word in-reach, and I'm going to get to that so that you understand what's different from an organization that maybe goes out in the community physically and educates to a phone-based service like 211. So first, we're trying to get the word out, and so we've created a 1-minute video in Spanish and in English. I'm playing the English one right here, but in Spanish and English, to educate from a 5-year-old to a 100-year-old about the service. And both these videos are on our website, and you can have them available. So as we're trying to build awareness of what 211 is, you can have this as your reference. This thing's spinning, which is never a good thing. Try. So this is where my Macintosh is. I'm going to close out of here.
What is 211? It's three simple numbers that connect you to more than 6,000 community health and disaster support services. There are times in our lives when we all need help, or we know someone that does. 211 is your free one-stop connection to access the support and services for some of life's most challenging situations. If you're struggling to pay your utility bills and provide food for your family, if you're a veteran in need of support, guidance, or information, if you're caring for an aging parent and not sure where to turn, or if you're the victim of a disaster seeking updated information, 211 is here to help. You are not alone. 211 helps thousands of people every year get connected to the information and resources they need. Simply dial 211 24 hours a day, 7 days a week, and you'll be connected to a live, highly trained information specialist who can assist you with your specific need. Or search online for services at our website. And 211 can provide help in more than 200 languages. You may not need us today, but we're here when you do. 211 San Diego. Real people, real connections, real help. Brought to you by 211 San Diego.
Who knows about 211 now? Pretty easy. We're actually, and we'll reframe the end of it so that it says 211 Imperial at the end. Again, we want to make sure that we're branding properly here so it's not confusing. So sometimes when we talk about 211, it's important to reflect about 60 years ago when there was this number that was being talked about called 911. Because there were places just like Imperial, just like San Diego, just like Los Angeles, where if you needed to call the police department, you didn't know what number to call. Right? I mean, there were dozens of different hotlines, dozens of different emergency numbers for an ambulance or for a fire truck. And obviously, in infinite wisdom, we have a federal mandate that there's going to be a 911 system. Who here knows about 911? I'm making you exercise today. You're going to move. No one knows about 911? How many people know about 911? You can actually lift your arm. It's a good thing. Physical, brain, it's all good. We're going to mind, body, spirit today. So, information referral has been around for many years. The United Way has information referral over 40, 50 years, which was basically a community chest, a place where all the organizations in town were in, whether it was a notebook, whether it was a directory, now it's online through a website, but it's basically the concept of, we kept hearing about HUB, right? With Covered California, with healthcare reform, with food programs, the community needs a hub, a place to go. Not so the public only can reach out, but if I'm an agency that specializes in senior services, I may not know all the transportation services out there. And so this community hub, these information referral organizations over the years became more and more relevant in communities that were growing. And then in '97 in Atlanta, the FCC put the mandate out that this last 3-digit number, you know, you've heard of anyone ever use another 3-digit number besides 911? 411? 611. What's 611 for?
Phone repair.
Phone repair. Anyone else? What's 411? Information. How much do you have to pay for that? $1.75? Who called 411 recently? Really? You called 411? What'd you call 411 for?
Actually, my wife called, but I was with her.
Yeah. No access to internet?
No, we were driving.
There you go. But no one else raised their hand. So, someone else did. So really the idea was, hey, we have all these information referral providers throughout the country. We already have these resources out there. If we could connect a number to access those, an easy to remember number, so that no matter if you live in New York or California, you would know to actually call the number. That's where we were. And again, in 1997. So as a movement, we're going on about 16 years of service. Us in San Diego started our service about 7 years ago. And so that's kind of how we came into be. And here we are today. We answer over 1,000 calls a day. We have 80% of our staff are bilingual. We also have over 200 languages supported through teleinterpreters. And these calls range from any one of these items that are up there. 6,000 programs and services that we connect San Diegans to every day. And I'm proud to report that we're getting calls from Imperial now. June 1st we launched, again it was a soft launch, and I think a big reason is we're trying to get our ducks in a row. We want to make sure that all of you feel comfortable with the service before we roll it out to the entire community. That we're knowledgeable about all the resources that are available. That we're handling a call culturally competent to how Imperial residents want to receive that service. So we've kind of met with individuals in this room. Who have we personally met with one-on-one? A number of people in the room? Nobody? You're not raising your hand. Raise your hand if we've met with you. There we go. All right, this is hard, I know. I'm supposed to be doing the work, but you're going to work. So a number of services. So what I thought I would do is kind of show you what happens in a 211 call. Obviously, we say hello. We're 24/7. 7 days a week, 24 hours a day, there will be a live person ready to answer your call. We have almost 100 staff. They're highly trained staff. They receive about 8 weeks of training before they even answer a phone call. They come with a background. Some come with social service background, but a lot of the time we're finding that that's not the most critical. It's really the most critical to have someone that actually is an active listener, that has customer service skills, that actually is okay being on the phone 24 hours a day. Well, they don't each one. Versus people who maybe have social work background are there to actually help the person through that crisis. Well, that's really not our job, that's all of your jobs. We want to make sure that people are empowered when they get there. So we're going to do an assessment of the situation. We're going to listen to what's going on. Obviously, we get crisis calls, and those we have different triages, whether it's domestic violence or whether it's suicide or things of that nature. So we are capable of handling it, although our center, that is not what we do. But we're not going to hang up on a person, and we're going to have a three-way talk when those things escalate and get that person handed off. But we're going to also clarify the situation. Someone may call in and just say, look, I got this notice from SDG&E that my power is getting shut off. Or, you know, I just lost my job and I need to know where to go for benefits. Those types of things. But what it ends up being is a conversation. In that first 30 seconds, if we can open up a dialogue with you to where you're going to trust me, you're going to know that I'm here to listen to you, because typically what happens is someone's called us after calling probably 5 or 6 different places and being told after they gave their whole story, sorry, you don't qualify, or you live in the wrong zip code. And so we don't want that experience. We want that experience to be, you know what, there may not be a service for you today, but we're going to help you understand how to navigate the services. And that's where our referrals come in. And you know, from a quality standpoint, we record every call. We have a team of staff that all they do all day long is listen to calls. And then they'll sit with one of our agents. Each agent gets a at least monthly coaching, where we'll play back that call and we'll do some self-coaching. What can we work on? Hey, you know what? This situation needed emergency food assistance. That would have been a great opportunity for us to identify if they were eligible for CalFresh, you know, our new SNAP program in California, not new. Well, that's kind of where I'm leading on with Cover California, right? These are individuals who might be at that level where they may know that they need a bed for the night, or they may know that they need a health service, but there's other programs that might also benefit them that they don't know about. And that's where our agents come in. So there's kind of what we did last year, 400,000 connections. We do measure customer satisfaction, so every customer who calls us gets an automatic call back if they're willing to give us feedback. We get 1,000 clients a month giving us feedback, and that's kind of where we sat right now. 95% of our clients say that they would call back the service or refer the service to someone else. And that 98% referral accuracy, why aren't we 100%? Well, sometimes someone might get their information wrong. You know, their income, they might be off. Or one of our providers might say that they provide a service, they might have stopped and they didn't tell us. And so that's where we constantly refresh our system to make sure that we're keeping up to date. The other neat part is that there's other ways to access our information. You can go do a keyword search on our website, find services, eligibility information. All the information we have that we provide over the phone is available on our website, as well as we now have chat. So someone can go online and chat with one of our agents, which we're finding for our military and veteran callers who want a little bit more privacy, if you will. They feel comfortable maybe not speaking to someone, but actually going through chat. Deaf and hearing impaired also use that service quite a bit. So our telephony allows us to do what we do. When I started 6 years ago, we had the fires. We didn't have the technology we do today. We have partners like Qualcomm in San Diego who've been very fortunate to help us do our technology plan. So when we receive 50,000 calls during a time of emergency, our system's able to handle it. It allows us to do a lot of things that we weren't able to do before. Disaster response. Anyone ever used 211 for a disaster? No? So that was my third week on the job. We had the 2007 wildfires coming through, and we went from answering about 60 calls on a Sunday to about 6,000 calls that Sunday. And those were people evacuating, and it was the first utilization of 211 in California for an emergency. And what we learned over that time period was, first of all, we needed more phones, we needed more computers, we needed a bigger bandwidth, we needed higher technology. But the other part is we had 1,200 volunteers come in that were spontaneous volunteers that got training and then were able to deliver the calls. So the third day of the fire, we answered over 40,000 calls just in a day. And so it really kind of raised the awareness of ways that 211 could be used in times of disaster. So we've been called into action for a number of things. We even had tsunamis that we were called into action with. And kind of how the types of questions that come in during that time. Again, all this information during a disaster is online. Why do you think someone would want to call us if the information's right there on the website? Might be out of power. Any other? Not everyone has internet? Why else? Right. And that was the #1 reason why people said, they said, you know what, I know I just heard it in the news, and I just heard that, but I've been asked to evacuate my house. I want to talk to someone. And at the end of those reverse 911 calls that call people to say, you need to leave your house, at the end of that messaging it says to call 211. Every press release that goes out from the county at the bottom says for more information, call 211. And then what happens is we get those calls, tens of thousands of calls. We look at the data, and then we actually are able to give rumor control back to the county to say the next time you're going to do a press release or the next time you're going to do a press conference, here's some of the things that are on residents' minds. That really came into action with H1N1. The Public Health Department and us were on the phone every day before they did their talk, their update for the night, of what types of things are people asking for so they could hit the masses. So there's some of the disasters we've been involved in since the fires, 2007. We've done regional support, Hurricane Sandy. Those centers, those 211 centers in those parts of the country couldn't stay up and operational, nor would they want their employees to go into a center when they're supposed to be taking care of their families. So we handle a regional support in those areas. So I thought this was a good time. Sorry, my slides are. There we go. Is that better for everyone? I feel like I'm at the eye doctor. Better? How's that? How did I do it? So there's the nation. We have almost 91% coverage. Half of those centers throughout the country are a United Way 211 center. Half of them are independent like us. And really, once you call 1211, you've called 1211. Once you've seen 1211, you've seen 1211. They're all independent. And so different 211s focus. There's some 211s that focus heavily on crisis and transportation. Others that focus kind of like us, where we're a general line for a number of different services and then have some specialized services. And then you can see what's going on in Imperial, where just until the last time this map was updated, Imperial wasn't covered. We now have Imperial coverage. You can tell a lot of the rural counties north of, probably north of Southern California, if you will, are not having coverage. Those white areas don't have coverage yet. But we did launch the service here in June. We have had support from the Board of Supervisors. I don't know if Supervisor Ransom is still here.
He left already.
What's that?
He left.
He left. I'll put that down. He's heard my talk before. But really the goal right now is to sit down with leadership within Imperial and design the service. And that's really some of the discussions that we're having. Covered California is a great opportunity. When we applied for the grant, we decided to build in Imperial County to our coverage because it was a great way to bring services and do it in a streamlined fashion. We also built LA and Riverside because we're working more as a network to try to do a bigger outreach. So when we talk about, whether it's television ads or radio ads, we have more purchasing power to go out and get visibility. So the big picture of 211 in our county, we have something called Live Well San Diego. It's something that's been set from a board of directors, from the board of supervisors level to say, let's think a little bit more regionally when we think of San Diego and health, and not just on basic needs. but safer sidewalks and safer streets so people can walk, and healthier foods in markets and restaurants, and all of those things come in. And one of the things that popped up is, well, when you have all these great services and you start all these great programs, how does anyone know what services are out there? And so this is a little clip of something that kind of describes what's going on there. Let's see. And if it doesn't work, then
Good health doesn't come from working in silos. I mean, the County of San Diego doesn't do this all by itself. We have a lot of public and private partners. And the key is to make sure we're all working together, that we're all on the same page, delivering care and information to the most vulnerable populations, while still maintaining high quality and being cost effective. A good example is 211 San Diego, a one-stop shop. Here, these representatives can help you with questions about everything from Medi-Cal to mental health services. 724-365.
When people call 211, they may be calling for a housing assistance issue or employment-related issue. And what's nice is, at 211, we're able to direct them to all the county programs, also determine if they might be likely eligible, where's the closest location for them to apply. So whether it's CalFresh or whether it's Medi-Cal or housing, all that put together really builds a Live Well San Diego.
Phone calls get referred to social, health, and behavioral services. Those 211 referrals are credited with getting more people applying for CalFresh, the state's food stamp program.
We've seen double-digit increases in the number of recipients since we started. And we have well over 200,000 recipients receiving CalFresh nutrition assistance benefits.
So what's happened is as we've started receiving calls, you know, I mentioned over 1,000 calls a day, we look at those calls and look at the trends, look at what people are needing. And, you know, in that case, a few years ago, we noticed the number of, the great increase in calls for food assistance. And then we heard the trouble that's happening throughout our state in terms of getting people on CalFresh, because it's a 16-page application. There's all these barriers to access for these programs. Number one is people not knowing where to go, and enter into a partnership to try to raise awareness. And actually, we now complete CalFresh applications over the phone, as well as Medi-Cal applications over the phone. And that just allows one more option for someone with you know, the multiple doors, if you want to say it. I think, you know, we want to make sure. I think the presentation is no wrong door is really kind of the concept that we want in our community as well. So that's our benefits and enrollment. I've talked about our disaster response. We have a partnership with First 5 San Diego. The First 5 line is actually answered by us for San Diego, and we actually help cross-promote their program, get the word out. I'm going to get into health navigation, but the other one is about 2 years ago, we noticed a number of our community leaders were talking about the issue going on with transitioning veterans. We live in a community in San Diego, the largest returning military population in the country. And what we noticed was we also are hearing rumors, and you've heard from probably a number of national reports, the high suicide rate. And the number one issue that came up on the needs assessments, both locally and nationally, was access to information. That was the number one issue. And when we dissected the report, it wasn't necessarily they didn't know where to call, but they needed to feel safe. So there were some models of peer-to-peer. Hire a veteran to help a veteran. So we now have 6 veteran staff, so when someone calls into our center and identifies themselves as a veteran, we get them on the phone with a peer support specialist that can help them through their situation. And lastly, I want to just go through the health navigation side. With funding that we received actually initially from Alliance Healthcare Foundation, because they noticed the need to have a central point, and they wanted to utilize the 211 system, was what else could we do? 25% of our calls have a health-related need. Well, if we're just kind of bypassing that and giving them the first referral and not going a little deeper, we're missing an opportunity. I think the presentation before this said, you know, we want to eliminate the need for people to run into an emergency department and create a medical home if we could. So we've tried to do that with our community clinic appointment setting. And so we're piloting that right now when people call in. But also application completion. We also do prescription drug assistance programs, and a number of things are coming online that we're doing, which kind of leads into a new program called Cover California. So real quick, everyone here does outreach? Who does outreach in this room? Can you tell me how you do outreach? Can you tell them how you do outreach?
I have different strategies for doing outreach. Obviously, engaging the community through local venues, local activities,
Like what?
events.
Okay. So you guys show up at a special event, you have a booth?
Sure.
Okay. Who else does outreach? How do you do outreach?
I use it social media. It gets me out there, and a lot of my social media works out there. I've done it, and a lot of my clients are on the East Coast, not the West Coast.
So you do social media?
Yeah.
Who here wants to do social media? Get his business card, and you guys can do social media together, right? Because wouldn't it be great for you to promote maybe other activities and things like that? So at 211, we do some outreach, and we're out in the community promoting the service. But we also do, which, you know, there's the definition. I thought it was kind of interesting. You know, it's that population of people that might not take advantage of something without having this opportunity to see you or hear your message or be on social media. So we at 211 talk about inReach. So I have this kind of cute little clip that I've been playing with, but on the PC it may not run for me. Let's see if it does. Yeah, there it is. So I kind of picture covered California being this kiosk right in the middle here. We have thousands of people coming through our system each day who, if they didn't call us and we didn't kind of put that kiosk up about covered California, they wouldn't do it. What did you think? Is that a good visual or not? Should I not use that again? Do you like it? It's almost, it's too short. It needs to loop a little bit longer while I'm talking. Okay, good. Thanks for letting me play on this. Kevin, how are we doing? Did you like that clip? All right. So, thanks for playing with me, guys. It's a lot more fun. Yeah, there it is. One more time. Okay. So, short and sweet. But, you know, you have to think differently, right? I mean, when we're talking about 911, we can all sit here and say, no duh, of course we know 911. When did you learn about 911?
Kindergarten.
Kindergarten. Or, you remember the white pages and yellow pages? That first page you turn over and there's the big letter, you know, big numbers. So we're trying lots of different ways to change behavior so that people know to call us when they need us. So our role in Cover California, I'm going to bring up someone who knows a lot better than me, is Karis Grounds, who is our health program manager, just to give you a couple highlights of what we're doing with Cover California. So you want to cover that for us?
Yes.
Who's heard of Cover California? Oh, this is a great crowd. There you go.
Hello, everyone. We've talked a little bit about this and what our role is. So I know we've heard this a few times, but we're basically we're trying to cover all of Southern California. So we have a grant to cover San Diego, Imperial, Riverside, and Los Angeles. And so we're planning to create awareness of over 800,000 Southern Californians, as well as reaching 150 through outreach education activities in the local community. So our plan is, Imperial is a big part of this. And so we want, in our unique setting and knowing that we're new to Imperial area, we have a few strategies of how we're going to be able to cater to the needs of this community. So basically what we do with Cover California as outreach and education certified staff, and you have a one-pager in your paperwork that you'll be able to kind of see exactly what we're doing, but we will provide outreach to people, so we will explain what Cover California is, what most people might know what ACA is, what the Affordable Care Act is, but Cover California is a completely new term to most people, and what it means is very big. So we want to educate people about what Cover California is. So just throwing out the name, it's this marketplace for health exchange. And then we want to provide education, individual education to consumers. So your clients could come to us and hear what Cover California is, and we'd be able to provide them with details about how much it would cost them. We'd be able to go through a calculator and provide them information about depending with your income, your children may qualify for Medi-Cal, but you'll qualify for coverage will cost you between $0 to $100 depending on what kind of tiers. And maybe this information doesn't really make sense to you because we haven't had an in-depth Cover California talk, but we'll be able to go into details about what Cover California is and how it relates to them directly. And they'll be able to talk to a certified specialist about what exactly it means to them. So that's what we're trying to provide as outreach specialists. And then at the end, if they're interested to enroll, and we'd be able to kind of cover those barriers that might make them not want to find out more information or understand why it would apply to them, we'd be able to loop them into an enrollment specialist, and they'd be able to enroll in Cover California and get those in-depth information. So really we're trying to break down the barriers, allow them to ask questions, find out really the affordable or Cover California is affordable, and it's something that is available to them and something they need to have and the benefits of it. So I know Dr. Beige talked a little bit about the essential benefits and some of the different federal poverty levels and how that's all confusing. We want to make it easy for these consumers to come in and be able to understand exactly how it applies to them. So we will plan on screening people through phone calls. When people call from Imperial, you know, they might call for another need, but once we find out that they don't have insurance, we'll be able to tell them, you know, I don't know if you heard of it, but there's things called Cover California, and you might be eligible to apply and get affordable health care. So there's two different venues. When they can call directly for Cover California information. They can get looped into more information if they're calling for another referral. And we're planning to do outreach events. So we talked a little bit about the one-on-one education, the middle tier, open enrollment. We cover this all with someone, as well as the fact that we have Inhouse Medical, so people can apply for, or we can send them to the right resources. We actually only have Inhouse Medical for San Diego, but we're working on getting Imperial to be able to have clients call and be able to apply for Medical with callers. So our plan and our strategy for Imperial is to, should we talk about this? Are you going to talk about this?
In terms of what specific? Did I have another, like, cut you out on the slide?
Well, this is our strategy in Imperial. So we're basically trying to screen all of our calls, all of the Imperial calls that come in, which are, you know, since we just did the soft launch, it's not very many people yet, but we're growing, and with your help, we need your help to send people to 201 to get more resources. So we're screening all Imperial calls to see if they're applicable to learn more about Cover California. The majority of our work will be in outreach events, so we would love to hear if there's an upcoming event that you think we could come as a booth and talk about Cover California, please let us know. And we will be doing, we're planning on having a Spanish speaker there available so that, you know, the language barriers won't be an issue. We'll be able to talk to someone that speaks the same language. We'll reach out to local media stations, Intravision we're working with to try to get the word out that we are a resource for Cover California information and people can call. And we plan to we have a website for Imperial County, but we'll have a centralized calendar of events. So when we have upcoming events that we will be at as part of Cover California, we'll be able to go to our website and you or your consumers can click and find out exactly where they are, where will be in Imperial, and more information if we're going to do a presentation or a booth. So there's different ways in which you can find out information. You can call, you can look on our website, you can follow our Facebook, or you can also get on our email list, and we can send you email blasts through ongoing communication and send you updates about what's going on in Imperial and send people your way. So that's our strategy as of now, how we're trying to reach out to you, and we're excited to be here. So
thank you for that. Thank you. And I think that last part's important because what we're finding by being pretty much at the ground level with Cover California and with the healthcare reform is everything's changing. So every week something new comes out, well, that's our job, and our role in it is to not only understand the information, train our agents on it, but disseminate that information. So if we can help you from that standpoint. So I kind of put this up here because it's true. We really, even though we've been out here a few times and we're starting to answer calls, it's still a slow process, and we're intentionally doing it slowly because we need to maintain trust. You know, if any of you have called us, gotten feedback, we need that feedback. But right now, 201 isn't known in the community. And what we know from San Diego is that 80% of our callers come from either word of mouth or a repeat caller. So word of mouth comes to you. If all of you feel comfortable enough, or if you don't feel comfortable enough, let's get together and figure out how do we get that comfort level up so that all of you feel comfort in referring people to us. I think that's probably the best way to get it. The awareness is low. We've kept it purposefully low. But as we want to build awareness, I'm thinking we can do it together. And it seems like there continue to be multiple hubs, even in Imperial, but we're slowly getting those aggregated together. So if there's other resources that you're not finding us connected to, you can connect us as well. We know that Covered California is complex. Healthcare reform is complex. It's scary. It reminds me of a few years ago with CalFresh, when we started talking about food stamps. There's barriers to access. People are embarrassed. People don't necessarily want to be on a government program. There's these stigmas, but really the government has come a long way to try to make it as consumer friendly, but there still is that barrier, and that's our job, is really to be to empower clients to take that next step. So that's, I think that's really all I have to say. I know we're going to have questions in a little bit, so I won't ask for questions, but I really want to ask for one question. Can I ask one question? Okay, who has a question? All right, you're up.
You have an app?
We don't. Use an app? We don't, but we will. We just got a grant. Actually, we didn't just get a grant. We got a grant a year ago. It was quite a sizable grant, almost a $2 million grant to upgrade our entire technology platform. The grant contract took almost a year to get through and get signed, and we're going to be doing RFPs within the next few months. And one of the benefits of that new technology platform is to have an app. But all of our information is on our website, which you can access.
My last question is, I was past chair for the Homeless Task Force in Imperial Valley, and that's a big stigma here and all over the state of California. Are you guys having, I know they had that problem in San Diego as well.
Yeah, and we're tied in with all the HMIS and the Regional Task Force for the Homeless as far as being a connector. In fact, if you need a shelter bed in San Diego, it's set up that you need to call 211, and then we work as a conduit for all of them. So, thank you for those questions.
Thank you, John. I'm not going to criticize you, but you did go a little bit over, so we're going to alternate.
I thought I had extra time.
Yeah, you used it all.
Okay.
We're going to alternate the plan a little, so let's get up and get our lunches so that we can